What's going on, world? Welcome. Today is, what is today? I don't even know. I don't know what today is. Today is Wednesday. And my eyes look 1,000 times better than they have been looking. So I'm just letting y'all know what's up. But hey, welcome. You guys already know what we're about to do. We're about to do NCLEX questions today. I need everybody to get notified. I need everybody to come up in here. I need everybody to smash that like button. I need for you to follow. I need for you to share. Because, I mean, obviously, you're not selfish, but you already know we ain't going nowhere and we ain't doing nothing until I get 100 people and 1,000 likes up in here. So y'all need to make it happen. Y'all test me if y'all want to, but Nurse Daddy K ain't playing with y'all today. You know what I'm saying? Hey, that rhyme. Shout out to me. But hey, I want to know who you are, where you're from, where you're at. Oh my God. Nurse Tibby, Miss Ma'am, how are you? I did not think. I said that not thinking that you were going to be in here, and there you are. So thank you. I appreciate you being here. Ma'am, how are you? I need to know who you are, where you're from, where you're at in your nursing journey. Hey, if you're in nursing school right now and you need to share this. You need to share this with people that you're in nurse school with, right? And your cohort and cahoots, whatever. Gina says NCLEX Friday. Okay, girl. All right. So come back. You're going to come on Friday. You're going to let us know. Tomorrow, better make sure you don't do nothing. All right. You make sure that you relax and you chill. All right. But hey, if you guys are new here, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. I need 1,000 likes and I need 100 people up in here. So I don't know what y'all are doing, but hey, I can sit here all day and just talk to you. I'll hold out on the questions. You know what I'm saying? Noelia, how are you? Connecticut, shout out to you. South Africa, you take your NCLEX on the 5th. Okay, shout out to you. What else? Where else is everybody from? Hey, we're at 43 people in here, you know, only at 300 likes. Shout out to Jersey. Hey, if you guys are new here, a little bit about me. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. I did 16 years in the Navy. I just recently got out in January 6th of this year. So that's just a little bit about me. I'll tell you guys some more as we truck right along. NCLEX on the 3rd week of March. Shout out to you. Not the Galaxy, Nurse Tibby. I appreciate you. Thank you, ma'am. I think that's the first Galaxy I've ever gotten, so thank you. Shout out to Florida. What's up, Ebony? How are you? Hey, we're at 78 people and at 800 likes, so hey, I just passed my HESI. Shout out to you, Red Sniper. Shout out to you, Big Ballin'. You Big Ballin', not me. Because hey, you out here giving out galaxies. Now I'm about to make that the standard. All right. Hey, we got 1,000 likes. Y'all gotta share. Y'all gotta smash that like button. Y'all gotta follow. Look, it's just this lonely set of questions that's over here. Just lonely sets of questions. You know what I'm saying? So what are we doing? Really? So shout out RN from Ghana. Shout out to you. Should I go accounting or nursing, y'all? Just do what you want, bro. What are all your degrees? I have a nursing degree. There you go. So we got 95 people up in here, 98 people. Hey, as soon as I see 100, there it is, y'all. There it is. See, that wasn't so hard, y'all, was it? Hey, y'all already know what the deal is. We're doing NCLEX questions. I won't hold them out on y'all anymore because, you know, y'all were so gracious to me. Shout out to the Philippines, Miss V. I see you out there. Here we go. And question number 1, Mr. Rodriguez is admitted with severe pain in the knee. Which form of arthritis is characterized by urate deposits and joint pain, usually in the feet and legs, and occurs primarily in men over the age of 30. Is it septic arthritis, traumatic arthritis, intermittent arthritis, or gouty arthritis? What are we thinking? By the way, oh my God, for once I can see it. Look, all right, I will turn the whole shade down so you can't see it. How about that? You can't even take the Galaxy back if you wanted to now. So shout out to all 200 plus y'all out here rocking with me. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, all of a sudden I'm not going to be able to talk and my computer's going to shut down. I don't know what happens. At that point. So y'all need to make it happen. All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D. Of course, it is gouty arthritis. Gouty arthritis, a metabolic disease, is characterized by urate deposits and pain in the joints, especially those in the feet and legs. Urate deposits don't occur in septic or traumatic arthritis. That is part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. All right, some people are going to say these questions are easy. I don't care what you think these questions are. Just answer them. I got them off nurseslabs.com. They're free sets of questions. You guys can go over there and check them out. If you got these wrong, you guys need to read your questions. You need to read your rationales and you need content. That's the trifecta. Just like how I need for y'all to smash that like button and share so I can get on the For You page. Here we go. Question number 2. A heparin Infusion at 1,500 units per hour is ordered for a 64-year-old client with stroke and evolution. The infusion contains 25,000 units of heparin and 500 mLs of saline solution. How many mLs per hour should be given? Is it 15 mLs, 30 mLs, 45 mLs, or 50 mLs per hour? What are we thinking? Shout out to everybody out here rocking. We're doing NCLEX questions both for RNs and LPN candidates. All right. RN and LPN candidates. All right. Make sure you guys smash that like button. You guys share. You guys follow. If you're in nursing school right now and you haven't shared it to people you're in school with, all right, you're wrong. And I need for you to fix yourself. All right. I don't care if you don't like them. Share it anyway. What's up, Samantha? How are you? Samantha, one of my frequent flyers. All right. A bunch of people are saying B. You're not mathing today. That's okay. You're in nursing school. That's okay. Answer it anyway. By the way, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, right? And if you're not a nurse, what are you doing here hanging out with us? But here's our answer in 3, 2, and the answer is B. It is 30 mLs an hour. All right. Somebody said that they're not mathing. Well, we're gonna spell it out for you. An infusion prepared with 25,000 units of heparin in 500 mLs of saline solution yields 50 units of heparin per milliliter of solution. The equation is set up as 50 units times X. The unknown quantity equals 1,500 units per hour times the equals, which equals, 30 mLs per hour. That's part of pharmacological and parenteral therapies, which is part of dosage calculations because it's one of the categories that's in there at 13 to 19% on the NCLEX exam, making it the second largest section. All right. Shout out to you, Maggie from Kansas, debating on becoming a nurse. Hey, do you, boo? It's not for some people, and that's okay. All right. Lucy, for 14 years at LP and currently in the RN program, 1 semester in Miami. Shout out to the MIA. All right, here we go. Question number 3. A 76-year-old male client with thromboembolic right stroke had a thromboembolic right stroke. His left arm is swollen. Which of the following conditions may cause swelling after the stroke? Is it elbow contraction secondary to spasticity, loss of muscle contraction decreasing venous return, DVTs due to immobility of the ipsilateral side, or is it D, hypoalbuminemia due to protein escaping from an inflamed glomerulus? All right, what are we thinking? Hey, these are like some tongue twister words. A lot of these words you're probably like never going to say anymore, and that's okay. So somebody said, who's just said that they passed BMMG 13 PASS NCLEX last week? Hey, shout out to you. Thanks. You're welcome for the lives. I do these lives every Monday, Wednesday, Friday at 5:30. So congratulations to you. Welcome to the greatest shit show on earth known as nursing. If there's a piece of advice that you could give, what advice would that be? Once again, shout out to you and congratulations. All right, but the answer is B, loss of muscle contraction, decreasing venous return. In clients with hemiplasia or hemiparesis, loss of muscle contraction decreases venous return and may cause swelling in or of the affected extremity. That is part of physiological adaptation. All right, which is the third largest section on the NCLEX. My man Jay is here. Appreciate the love, brother. Thank you for being here. Physiological adaptation, 11 to 17%, third largest section on the NCLEX. All right, so hey, if you got it wrong, you need to circle back. I call it the TBN 360. Circle back. Go get that content. Still get your questions and answers, and you need to read your rationales. Your rationales is what helps you retain the information. Hi, Kevin. Just finished my exam and stopped at 85. Pray for me. I ain't going to pray for you because you got it. But I mean, I don't need to do nothing for you because you got it. It stopped at 85. Either you did really well or you did terrible. Guess we're going to find out on Wednesday, right? But you good. You good. I got you. You got it. 85 is the minimum. Indeed it is. All right, here we go. Question number 4. Haberden nodes are a common sign of osteoarthritis. Which of the following statements is correct about this deformity? Only appears in men. It appears in the distal interphalangeal joint. It appears in the proximal interphalangeal joint, or it appears in a distal lateral aspect of the interphalangeal joint. What are we thinking? Shout out to all 191 of y'all out here rocking. We're doing NCLEX questions here on this Wednesday. Make sure you guys like, share, and follow. I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. And if you're new here, make sure you smash that like button. Make sure you guys share. Make sure you guys follow. Sharing and following is what the TikTok algorithm needs to get to people's For You pages. All right. So stop being greedy. Stop being greedy. Have to go cook it in. Hey, ma'am, first of all, what are you about to go cook? Hey, let us know what you about to cook, because you can go ahead and send me a plate. You know what I'm saying? But here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is B. It appears in the distal interphalangeal joint. Herbertin nodes appear in the distal interphalangeal joint of both men and women, both physiological, a solid rationale, right? Hey, depending on where you get your questions, they'll be more thorough or they'll be just this short, but their physiological adaptation, third largest section on chicken Alfredo. Hey, go ahead and send me a plate. I'll DM you the address. Physiological adaptation, third largest section on the NCLEX, 11 to 17%. All right, 11 to Sarah. There go Gina right there with that solid rationale. Gina, I'm gonna put that on a shirt. All right. Hey, if you got it wrong, that's okay. Right. And if you don't understand it, that's okay, too. That's what the content is for. Make sure you circle back and you get that content. All right. Here we go. Question number 5. Which of the following statements explains the main difference between rheumatoid arthritis and osteoarthritis? Osteoarthritis is gender specific. Rheumatoid arthritis isn't. Osteoarthritis is a localized disease. Rheumatoid arthritis is systemic. Osteoarthritis is a systemic disease, while rheumatoid arthritis is localized. Or is it osteoarthritis has dislocations and subluxations, and rheumatoid arthritis doesn't? What are we thinking? Shout out to all 300 plus of y'all. Hey, if you're just joining, a little bit about me. I have been a nurse for 3.5 years. I've worked ICU, OR, and PACU. PACU is the holy grail in my opinion, but that's just me. I also was in the Navy for 16 years. I just actually got out in January. And I was an instructor for a long time, actually 9 years. I hit being an instructor in January. I've taught surgical technology, trauma nurse, tactical combat care, pre-hospital trauma. So I have a really extensive background in education. So I love it. I'm in a master's program to get my master's in nursing education. So I love being here. I love teaching y'all. I appreciate y'all participating. Make sure you guys like, share, and follow. And of course, I want to know about y'all, who you are, where you're from, and where you're at in your nursing journey. Shannon says OR, they are asleep the whole time. I like the OR. I like PACU. I like both, honestly, but I think the PACU is the holy grail, in my opinion. And the answer is B. Osteoarthritis is a localized disease and rheumatoid arthritis is systemic. That's part of physiological adaptation. Solid rationale. Once again, Gina, it's a solid rationale, right? Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. She's a senior 12-week Lex, Montana. Yeah, shout out to Montana. I ain't never been there, but I heard it's really nice. Ladies and gentlemen, hey, if you're just now joining, hey, I got some quick tips, some quick testing tips to help you conquer the NCLEX. It's a free download, 42 pages of just deliciousness that'll help you, essentially conquer the NCLEX, right? Some phrases, some key things, key terms to look out for. So you guys can check that out. That link is also in my bio, but you can check it out right there at thebootnurse.com/test. All right, here we go. Question number 6. Mrs. Cruz uses a cane for assistance in walking. Which of the following statements is true about the cane or other assistive devices? A walker is a better choice than a cane. The cane should be used on the affected side. The cane should be used on the unaffected side. Or a client with osteoarthritis should be encouraged to ambulate without the cane. What are we thinking? I saw somebody say they were from Montana. Where else is everybody from? Got a bunch of C's up in here. Noelina says C. Gonna go with C for Mrs. Cruz. All right, Gina, I see you. It says by last name is Miss Cruz. Wow. Massachusetts. Did I say that right? Massachusetts. Missouri. South Kakalaki. All right, I see y'all there. Alabama, home of the WWE chairs. I see y'all. Florida men and women. I see y'all out there. Canada, Jersey, Toronto, Canada in the house. Okay. The Philippines in the house. I love my Filipinos. I love y'all. Chicago, Chirac. See y'all out there. All right. Michigan. All right. Here we go, y'all. Here's our answer in 3, 2. Nova Scotia. That's a first. Shout out to Philly. I see y'all out there. But the answer is C. The cane. Somebody said C for Mrs. Cruz. Y'all wild for that. The cane should be used on the unaffected side. A cane should be used on an unaffected side. A client with osteoarthritis should be encouraged to ambulate with a cane, walker, or other assistive devices as needed. Their use takes weight and stress off of the joints. That's actually part of basic care and comfort. Manny, why are you surprised you got it right? Hey, you smart. You a smart cookie. You know what I'm saying? You smart out there. Basic care and comfort, 6 to 12% on the NCLEX exam. Smaller section, but hey, it's still part of the 8 sections of the client needs. Hey, and that's fundamentals, y'all. That's coming from fundamentals. I'm just saying. So remember these sections. You got 8 client needs that have categories and subcategories. All right. Question number 7, a male client with type 1 diabetes is scheduled for 30 units of 70/30 insulin. There is no 70/30 insulin available. As a substitution, the nurse may give the client what? All right. Is it a 90? Oh my God. See, this is why you got to read. Is it 9 units of regular insulin and 21 units of NPH? Is it 21 units of regular insulin and 9 units of NPH? 10 units of regular insulin and 20 units of NPH, or 20 units of regular insulin and 10 units of NPH? What are we thinking? You don't know? That's okay. Guess. You have a 25% chance of getting it right if you guess. Because on NCLEX, you can't go forward unless you answer a question. But also, you can't go backwards once that question is answered. So, come up with a solid, right? Equivalent. Okay. We got B's, we got C's, we got D's. Hey, if you guys are just now joining, we're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. We're also on the road to 10,000 likes. If we don't have 10,000 likes, in the words of Monique on Club Shay Shay, my throat hurt. And I can't talk. And all of a sudden my fingers can't work. My computer's going to shut down. So, I don't know. All right. But anyway, the answer is A, 9 units regular insulin and 20 units of NPH. A 70/30 insulin preparation is 70% NPH and 30% of regular insulin. Therefore, a correct substitution requires mixing 21 units of NPH and 9 units of regular insulin. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. Who said, Tyler, you can't say duh. You can't say duh. You must be new here because I've never seen you say that, and you must not know. So I'm going to tell you right now, we don't say duh. We don't do that. We don't stifle other people's learning up in here because we don't know where people are in their learning aspect. So you can't say duh. It's duh. Nah, it's not duh. Don't do that, guy. Don't be that guy, Tyler. Don't be that guy. All right. Don't be that guy. It doesn't matter. It doesn't matter. Hey, you already know. Hey, I've come a long way on cussing people out, but I ain't cuss him out. I told him don't do it. He did it anyway. So I blocked that ass. Here we go. Question number 8. Nurse Lynn should expect to administer which medication to a client with gout? Is it aspirin, Lasix, colchicine, or is it calcium gluconate? What are we thinking? We are a lot better than that. I want y'all to really think about this. If you were up formally in a class teaching a bunch of people and somebody was like yelled in the middle of class and they said duh to you, well, how would you feel? This is equivalent to that. People get on TikTok and have a voice when they really fucking shouldn't. So just saying, don't be rude to people. All right. Don't be rude and don't stifle other people's learning. Colchicine. Got it. Says good luck, kids. When the NCLEX like getting impossibly hard. It's a good sign. Indeed, it is a good sign. Hey, so the whole point on NCLEX is that you want to get to the hard questions. All right. Can you please explain number 7 again? Nope, because I don't even remember what it was. Here we go. We're on question number 8. If you missed number 7, sorry. This is where you have to go back and you have to look at the content aspect of that. Okay. So here we go. And the answer is C. It is colchicine, a disease characterized by joint inflammation, especially in the great toe. Gout is caused by uric crystal deposits in the joints. The physician prescribes colchicine to reduce these deposits and thus eases joint inflammation. Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. All right. Remember, my coaching method is just my teaching method is a little bit different. If we don't know, we go back and we find the answer. And by we, I mean you. And then you come back and you let us know. That's the best way for you to learn, is to teach others. Remember that. OK, remember that. But shout out to everybody that got it right. And if you got it wrong, you know what to do. Circle back. Even if you got it right, make sure you read your rationales. OK, question number 9. Mr. Domingo, with a history of hypertension and is diagnosed with primary hyperaldosteronism. This diagnosis indicates that the client's hypertension is caused by excessive hormone secretion from which of the following glands? Is it adrenal cortex, pancreas, adrenal medulla, or parathyroid? What are we thinking? And I know some people are going to come in here and be like, duh, these are easy questions. You will never see these on the NCLEX. Let me tell you something. The NCLEX has almost like an unlimited test bank, like 10,000 questions. easy and hard. So you have no idea what question they're going to ask you. So don't listen to people when they say, oh, the NCLEX will never ask you this question. If you're doing extremely well, hey, you're going to start getting really, really intensely hard questions. If you start doing bad, you're going to start getting really easy questions that you should have learned while you were in nursing school. Think about it like that. So you want to get to the hard questions. That's where we want to get, okay? I'd be like, damn, I should know this. It's okay if you don't know it. Remember, on NCLEX, you're not supposed to know everything. Because even if you know everything, they're going to start pulling out craziness, right? You want to know what everybody else knows, all right? And the answer is A, it's the adrenal cortex. Excessive secretion of aldosterone in the adrenal cortex is responsible for the client's hypertension. This hormone acts on the renal tubules, or the renal tubule, where it promotes reabsorption of sodium and excretion of potassium and hydrogen ions as part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right. Your largest sections: management of care, pharmacological parenteral therapies, physiological adaptation, reduction of risk potential. Those four sections alone make up more than 50% of the entire exam. All right. Hey, if you got it right, you know what to do. If not, hey, you still know what to do. All right, here we go. Question number 10. And ironically, my voice is starting to go out. I only got 6,500 likes, but whatever. For a diabetic male client with a foot ulcer, the doctor orders bed rest, a wet to dry dressing change every shift, and blood glucose monitoring before meals and bedtime. Why are wet to dry dressings used for this client? Is it A, they contain exudate? Exudate and provide a moist wound environment. They protect the wound from mechanical trauma and promote healing. They debride the wound and promote healing by secondary intervention. Or is it D, they prevent the entrance of microorganisms and minimize wound discomfort? What are we thinking? Everybody scream and C at me. You take your NCLEX tomorrow, Misfit 02. Hey, so you got two choices. I either block you or you leave. This is considered cramming. I don't want you cramming. You should be relaxing. You shouldn't be doing anything of the sort. You should be gone doing something else, watching anime or some shit, right? Not here. All right. You know it. You got all the information. You prepared correctly. You don't need to be here. Go relax somewhere. Go relax somewhere. All right. And that's just me. That's just me telling you that. All right. That's nothing but love, though. You take your NCLEX on Saturday. Well, cool. On Friday, I better not see you. All right. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And our answer is C. They debride the wound and promote healing by secondary intervention. For this client, wet to dry dressings are most appropriate because they clean the foot ulcer by debriding exudate and necrotic tissue, thus promoting healing by secondary intervention. That's actually part of health promotions and maintenance, which is a very smaller section on the NCLEX, but it's 6 to 12% of the client needs of the NCLEX test plan. Okay, so if you got it wrong, that's okay. I'd rather you get it wrong and learn to understand it here before you go and take your NCLEX. I'm just saying. All right, I would rather you do that. Do it here before you go do it on the NCLEX. Okay, and ladies and gentlemen, hey, I wrote a book. It's in pre-order right now, and it's actually going to be released on June 5th. Why people are asking on June 5th? Because June 5th is my anniversary of when I became a nurse. If y'all don't know, I failed my NCLEX 3 times. Listen, y'all, I failed my NCLEX 3 times. 3 times. And don't nobody care. And I don't give a shit about what none of y'all got to say about it. You want to know why? It's because 2 people aren't going to ask you, your patient and your job. No one cares. Get out of your own way. I wrote this book specifically for those who feel that they can't conquer it. Not just that, but anything in life. You see what I'm saying? No one cares. Get out of your own way. You are your own worst enemy. Don't let these people who have never walked a day in your shoes tell you that you should give up or you should do something different. If nursing is your calling and nursing is what you want to do, baby, you know what I'm saying? Make it happen. You know what I'm saying? And this book is not your traditional, hey, we talk about strategies and how to answer questions. We talk about the real struggle that we go through. Right? That's not what people talk about, the real struggle that we go through. And I also will tell you about some things that I did for myself, where I had an issue at and how I was able to fix that. All right. So first thing, it's going to be on Kindle, then it's going to be on paperback. But the goal is to get everything out on June 5th. So make sure you guys go check that out. All right. thebootnurse.com/books, or you guys can check the link out in my bio. All right. It says, can I say thank you Thank you. New inspiration from hey Maggie, I appreciate that. That's exactly why I do this. If you put jar, what? If you put jar, can I'm not even gonna try that. Like I already have a headache just trying to read that. It says, I love coming to your page to practice while I'm in school for RN. Rebecca, I love that for you. Here we go. Here we go. Question number 11. Nurse Zenny. It sounds like the character from Dragon Ball Super. But anyways, Nurse Zenny is caring for a client in an acute Addisonian crisis. Which laboratory data would the nurse expect to find? Is it hyperkalemia? Is it a reduced BUN, hypernatremia, or hyperglycemia? What are we thinking? Hey, if you guys are new here, welcome. Shout out to y'all, all 400 of y'all. We are doing NCLEX questions. My voice came back, so I don't know what's going on. Hey, we're on the road to 20,000 likes, by the way. I'm just letting y'all know. If you guys are new here, I got these questions off nurseslabs.com. They are free sets of questions. All right, you guys can go over there and check those out for yourself. If you're in nursing school right now, what are you doing not sharing this to people? Hey, we need over 100 shares. You know what I'm saying? I need to be in front of people. You want to know why? Because people need this. Don't be selfish, baby. Don't be selfish. I have Addison's disease, so I'm going to say B. It says because of low sodium in the body during Addisonians. Now let's see why. Hey, so Gina, solid rationale we got going on right now, right? So it's hyperkalemia and adrenal insufficiency. The client has hyperkalemia due to reduced aldosterone secretion. Reduction of risk potential, 9 to 15% on the NCLEX, the fourth largest section on the NCLEX exam. Does this match the the new generation NCLEX? So I'm going to tell you about the new generation NCLEX. The only thing, the content is not different. It's how the question is delivered to you. All right. So the way that the content is delivered to you is now they're doing it via a case study. Right. But the questions are not there's nothing different about them. The content is the same. The content hasn't changed. Instead of me putting it in this small sentence right here, I'm going to give you all this other information prior to that. OK, so you still have to know the content. You have to know, and they based off of giving you a case study, they'll give you a question like that. So based off of the case study, a client is admitted for treatment of SIADH. Which nursing intervention is appropriate? Same question. It's just delivered to you with everything else. All right. Is it A, infusing IV fluids rapidly as ordered? Is it encouraging increased oral intake, restricting fluids, or administering glucose containing IV fluids as ordered? What are we thinking? A whole bunch of people are screaming C at me. SIADH is oliguria. Okay. What else are we thinking? I'm going to give you guys 10 more seconds. C. Okay. Fluid overload. Okay. All right, y'all. Let's see. Gina, we're about to check. Hey, we're about to check this out. We're gonna see what this rationale looks like in 3, 2, and once again, Gina, you called it solid rationale, right? So we're gonna restrict fluids. So the answer is C, to reduce water retention in a client with SIADH. The nurse should restrict fluids. Sometimes it's that easy, ladies and gentlemen, and you guys got it, right? So physiological adaptation. All right, 11 to 17%, making it the third largest section on the NCLEX at 11 to 17%. Jenny, why are we saying rude? What happened? What are we talking about? All right, so hey, if you got it wrong, circle back. Get the content, understand why, and then keep doing your questions, your answers, and your rationales. Your rationales help you retain the information. Think R&R. Rationales help retain the information. All right, here we go. Question 13. A female client tells nurse Nikki, probably a stripper, but whatever, that she has been working hard for the last 3 months to control her type 2 diabetes mellitus with diet and exercise. To determine the effectiveness of the client's effort, the nurse should check what? All right. Is it urine glucose levels, fasting glucose levels? Is it was it the serum fructosamide level, or is it the glucose? Oh my God, the glucosylated hemoglobin level, hemoglobin A1C1. Lower, have mercy. All right. What are we thinking? Shout out to all 570 y'all. If you guys are just joining, my name is Kevin, your gracious host without a temper. I'm doing really well, right? We're doing NCLEX questions. Got them from nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. Also, if you're a nursing student, they have nursing care plans over there that will help you turning those care plans in. Trying to tell you, they work and they're great. So go over there and check them out for yourself. But here we go, y'all. Here's our answer. And 3, 2, and the answer is D, right? Our hemoglobin A1C, y'all. Okay. And I'm from Texas, by the way. I know I'd be asking y'all where y'all are from. I'm from Texas. I say y'all because that's what I do. Who said that? It says, this is definitely not an NCLEX style question, I promise. Nick, once again, you are new here. I've never seen you before. The test bank on NCLEX is everlasting. Unless you're an NCLEX test writer, you have no idea what type of questions are on here. And you have no idea what they're going to ask you. I'm just saying. So there's that. So because some of the glucose in the bloodstream attaches to some of the hemoglobin and stays attached during the 120-day lifespan of red blood cells, gluconated, I'm just going to say gluconated hemoglobin levels provide information about blood glucose levels during the previous 3 months as part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. It's actually the fourth largest section on the NCLEX exam. So once again, we have a bunch of people in here that are in different levels. We're at different levels of their nursing career. Some people opened their mouth and just said, hey, I'm thinking about going nursing. Some people are in nursing school. Some people have taken the NCLEX once, twice, a million times, So you really got to think about where people are in their nursing journey. And I'll be completely honest with you, it's like the NCLEX, the national board has tons, and I'm telling you tons and tons of questions. You have no idea what they would ask you. All right. But you have to be prepared on all fronts. All right. Just saying. Just be prepared on all fronts. Question 14. Nurse Trinity, also probably a stripper, administered NPH insulin to a diabetic client at 7 a.m. At what time would the nurse expect the client to be most at risk for hypoglycemia? Is it 10 a.m., noon, 4 p.m., or 10 p.m.? What are we thinking? And I could ask these questions in multiple different ways. You can ask these questions in multiple different ways. All right. These are just the ways that these are being provided. All right. If you guys are new here, welcome. Make sure you guys smash that like button. You guys share, you guys follow. We're on the road to 20,000 likes. 20,000 likes. So make sure you guys smash that. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. What are we doing? My NCLEX was hard. It was all priority based. OBGYN, L&D. Oh, man, I hate that for you. I'm not even gonna lie for you. I'm not even gonna lie. I hate that for you. Some psych and peds. I had a lot of cardiac medications and ailments. And that's why I feel like I enjoy that so much now. But here we go. Here's our answer in 3, 2. And our answer is C. It is 4 p.m. NPH is an intermediate acting insulin that peaks at 8 to 12 hours after administration, right? Because the nurse administered NPH insulin at 7 p.m., the client is at greatest risk for hypoglycemia between 3 p.m. and 7 p.m. That is part of pharmacological and parenteral therapies. Bethany, shout out to you from Australia. All right. That is 13 to 19% on the NCLEX, making it the second largest section on the NCLEX test plan, right? Cardiac is my kryptonite. Listen, if you're going to go ICU, anybody, if you're going to go ICU, I'm telling you, cardiac hemodynamics, you got to know that. You got to know it. You got to know it like the front and back of your hand. And it actually worked out well for me because that's where I went when I started working. Cardiac is my specialty now. My man, Nick, you know what's up, bro? You know the deal. Let them know. All right. Here we go. Question 15. The adrenal cortex is responsible for producing which substance? Is it glucocorticoids and androgen? Is it catecholamines and epinephrine, mineralocorticoids or catecholamines, or norepinephrine and epinephrine? What are we thinking? Somebody said, who said, I'm a med student here just testing myself. Look, yes, I appreciate you being here. I appreciate you being here testing yourself, because some people will say this is easy knowledge. It doesn't matter. It's knowledge for you. Take it or leave it. Either take it and enjoy it or leave. Then leave. Okay. Shout out to all 480 y'all listening to me run my mouth. We're doing NCLEX questions both for registered nurses and licensed practical nurses. Nurseslabs.com, free sets of questions. You guys can go over there and check those out for yourself. All right. The medulla. Why are you screaming like that, Kaylin? Oh, my goodness. But the answer is A. It's glucocorticoids and androgens. Oh, my God. The adrenal cortex has two divisions, the cortex and the medulla oblongata. Medulla oblongata. They're ornery because they got all that teeth and no toothbrush. Oh my God. I'm sorry. The cortex produces three types of hormones, glucocorticoids, mineralocorticoids, and androgens, right? It says, damn, I said D, and I'm in my prereqs. It says, come on now, I actually learned this in med school. Let's go. That's what I'm talking about. Hey, if y'all know, physiological adaptation, third largest section on the NCLEX exam. All right. Adrenal medulla, Waterboy earns a follow. James, that's what I'm talking about, bro. I appreciate it. Third largest section on the NCLEX at 11 to 17%. I think I'm gonna watch that movie later on. I passed my NCLEX thanks to your lives. Michaela, shout out to you. Y'all already know what to do. Give Michaela all the love right now. Congratulations, Michaela. Welcome to the greatest shit show on earth, known as being a nurse. All right. Congratulations to you. If there's one piece of advice that you could give to everybody here, ma'am, what would it be? So, of course, once again, congratulations to you. All right. Hey, ladies and gentlemen, by the way, I have an NCLEX course. I got a little NCLEX course over there. I got 2 NCLEX reviews, my 7-day review, breaking down questions based off of the NCLEX test plan. And I have a 100-question next generation NCLEX review that is over there. You can join the course plus be a part of the community for $7. Wow, that is terrible. I'm sorry. I watch way too much South Park. But anyways, listen, $7. Go over there and check it out. thebootnurse.com/special. You guys can also go over to the link in my bio and check that out as well. But hey, come over there and get you some of that knowledge. Hey, I got over 65 videos that are in there right now with more that we're putting in there. Okay, so y'all go over there and y'all check that out. It says, trusting yourself, always review the rationales when you take your practice test. Yes, still in prereqs. Take my HESI in April. Jalen, you're going to be all right. You're going to be all right. It says, honestly, just study your heart out, grind. Archer was helpful. I agree. I like Archer stuff as well. Paramedic student here, doing internship at the moment. So helpful with me. You're welcome. No problem. Do not simulate, did not simulate the NCLEX well. Right. I got you. Here we go. Question 16 on the third day of Christmas. On the third day after a partial thyroidectomy, is a Proserpina, whoever that is, exhibits muscle twitching and hyperirritability of the nervous system. When questioned, the client reports numbness and tingling of the mouth and fingers. Suspecting life-threatening electrolyte disturbances, the nurse notifies the surgeon immediately. Which electrolyte disturbance most commonly follows thyroid surgery? What are we thinking? A, Travasex and Trousseau's. Okay, Caitlin. All right, or Kaylin. I'm sorry, not Caitlin. If you know the data, it doesn't matter how they act. Exactly. That's why it's important for you to know the question. It's important for you to know the content. Content is important, but the questions help you and prepare you for what the exam is going to look like. Period. All right. I'm telling you right now, that's what it's going to do. In the military, we have a saying. It's called train like you fight. Right. You want to train how you fight. So you want content, you want questions and answers, and you want rationale. So guess what? If I overtrain by getting content and rationales, when I go and I take a test that has questions and answers, what do we think? Like, what are you really doing? What are we really doing? All right. So you got to practice. You need those 3 things. All right. And the answer is hypocalcemia. How hypocalcemia may follow thyroid surgery if the parathyroid glands were removed accidentally. Signs and symptoms of hypocalcemia may be delayed for up to 7 days after surgery. Thyroid surgery doesn't directly cause serum sodium, potassium, or magnesium abnormalities. All right. Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. So shout out to everybody that got that right. Hey, if you don't know your electrolyte imbalances, fluid and electrolyte imbalances, which are hypos and your hypers, calcemias, kalemias, natremias, magnesemias, you need to know them. You need to know the content so you can apply it with critical thinking for your questions. That's what you need. That's what you need to do. Okay. Here we go. Question 17. Which laboratory test value is evaluated in clients who smoke and can't be used as a general indicator of cancer, right? Is it acid phosphatate levels, serum, is it calcitonic or calcitonin level? Is it alkaline phosphatate level, or is it a carcinoembryonic antigen level? What are we thinking? I struggled with Addison's and Graves' disease. Oh man, I know a really good way to remember that one. For Addison or for Graves, not Graves' disease, Addison's or Graves' disease is, oh my God, hyper. Everything is up, 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 up. You're going to run yourself into the grave. Run yourself into the grave. I took my NCLEX on Monday and I found out I passed. Good luck to those studying for the exam. User71, I appreciate you being here. Thank you for sharing. Congratulations to you on passing your NCLEX, conquering your NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. What type of nurse are you, number one? And what advice would you give to all those that are taking their exam? This review is nice. My NCLEX is tomorrow. Lily, you have two choices. I can either ban you or you can go away. This is considered cramming and I don't want you here. You should be relaxing. All right. You should really be relaxing. All right, here we go. Here's our answer in 3, 2. And the answer is carcinoembryonic antigen level. In clients who smoke, the level of carcinoembryonic antigen is elevated. Therefore, it cannot be used as a general indicator of cancer. However, it is helpful in monitoring cancer treatment because the level usually falls to normal within 1 month if treatment is successful. That is part of reduction of risk potential. 9 to 15% on the NCLEX, making it the 4th largest section on the NCLEX. All right. You over the stream are helpful for me. Been a nurse for 5 years. Good luck, everyone. So you like UWorld? I'll be the one. I'll go against the grain and I'll tell you I didn't like UWorld. UWorld didn't work well for me at all. Didn't work well for me at all. That's just me though. So, all right, here we go. Let's see what you guys are talking about. It says, honestly, the NCLEX was the easiest test of all nursing exams. Y'all got this. So it's the easiest test for you. Remember that. Easiest test for you. Now, not knocking how you study, knocking how you obtain or retain information, but definitely easy tests for you. Not for most, but for you. You are an anomaly, ma'am. I can tell you that because most people definitely struggle with those exams. Electrolytes. Yup. Okay, here we go. Question number 18. Francis with anemia has been admitted to the medical surgical unit. Which assessment findings are characteristics of iron deficiency anemia? Is it night sweats, weight loss and diarrhea, dyspnea, tachycardia and pallor, nausea, vomiting and anorexia, or itching, rash and jaundice? What are we thinking? What are we thinking? No, yes. What are we talking about? Those aren't even answers. Here we go. Shout out to all 400 plus y'all out here rocking with me. Man, y'all got me to 20,000 likes. I appreciate y'all. Let's go to 30. Let's make it happen. Let's make it happen. Make sure you guys like, share, and follow. That gets it out to the For You page. All right. And gets me, 1,000 people in here watching me. So what do we think the answer is? Got these questions off nurseslabs.com. They're free sets of questions. If you guys want to go over there and check those out for yourself, you surely can. You don't have to sit here and listen to me run my mouth. But I love that you're here. So here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B. It's dyspnea, tachycardia, and pallor. Signs of iron deficiency anemia include dyspnea, tachycardia, and pallor, as well as fatigue, listlessness, irritability, and a headache. That's part of physiological adaptation, which is the 3rd largest section on the NCLEX exam at 11 to 17%. Danny says you take your NCLEX at the end of March. Hey, you less than 4 weeks now. Less than 4 weeks. So shout out to everybody that got this question right. Remember, you need content, Q&A, rationales. All right. You need to acquire the content, apply the content to make with your critical thinking to your questions. And you need your rationales. You need to read and review your rationales because that's how you retain the information. All right. I feel so ready. That's what I'm talking about. Be ready, baby. Be ready. Question number 19. In teaching a female client who is HIV positive about pregnancy, the nurse would know more teaching is necessary if the client says what? So what did this HIV positive woman that's pregnant say that is incorrect that we need to fix? Is it A, the baby will get the virus from my placenta? B, I'm planning on starting on birth control pills. C, not everybody who has the virus gives birth to a baby who has the virus. Or is it D, I'll need to have a C-section if I become pregnant and have a baby? What are we thinking? Shout out to all 446 of y'all out here rocking. For those that are new here, hey, y'all, I failed my NCLEX 3 times. I failed my NCLEX 3 times. Why? Life. Had a lot going on in life, right? Thought I could just go in there and take the NCLEX without studying properly for it. Had a lot of other issues going on, family-wise, relationship-wise, you name it. Everybody has a sad story, bro. Everybody has a sad story. How are you going to rewrite your story or continuously write your story when you improve upon it? You see what I'm saying? I tell you, I failed my NCLEX 3 times and no part of me gives a shit about what any of y'all think, right? And you know who else is not going to care? Your job and your patient. But remember, you need to be able to be a safe nurse. You need to be able to go out there and do great things. All right. So learn from your mistakes. All right. Get out there and do the damn thing. I failed my NCLEX 3 times too. Ended up using Archer, cheaper compared to most and helpful. Shout out to you, Cameron. The baby. Yep. There we go. So here we go. And our answer is D. I'll need to have a C-section if I become pregnant and have a baby. A cesarean section delivery isn't necessary when the mother is HIV positive. Now, a cesarean section would be useful for what type of issue that a pregnant woman would have? Y'all let me know. Let me know. Like, when would I do a C-section? There you go. Destiny said it. If they actively are having an outbreak of HSV. Right? So shout out to y'all. Why? That can cause blindness, breach as well, but I'm talking about if they have some type of disease process. But I was talking specifically about, you're talking about gonorrhea, syphilis, but I was specifically looking at herpes, but you are not wrong with those answers. All right. So health promotions and maintenance, which is 6 to 12% on the NCLEX exam, smaller section on the NCLEX. All right. I absolutely appreciate your effort in giving us this setup. Marissa, this is what I do. This is what I do. And I enjoy it. If I didn't like doing it, trust me, I wouldn't be going on a year of doing it if I didn't like doing it. Trust and believe me. All right. Here we go. Question 20. When preparing Judy with acquired immunodeficiency syndrome, also known as AIDS, for discharge to the home, the nurse should be sure to instruct or to include which instruction: put on disposable gloves before bathing, sterilize all plates and utensils in boiling water, avoid sharing such articles as toothbrushes and razors, or avoid eating foods from serving dishes shared by other family members. What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. Got them off nurseslabs.com. They're free sets of questions. Hey, if you guys get the chance, make sure you guys go over to the link in my bio and see everything I got going on over there. Got a free download over there for you. 42 pages of greatness to help you conquer the NCLEX. Got an ebook over there. 7-day NCLEX course. Hey, you can join the 7-day NCLEX course for $7, y'all. Hildy, how are you? $7. Y'all can check that out as well. All right. But our answer, here is our answer in 3, 2. And the answer is C. Avoid sharing such articles as toothbrushes and razors. HIV, which causes AIDS, is most concentrated in the blood. For this reason, the client shouldn't share personal articles that may be blood contaminated, such as toothbrushes and razors, with other family members. That is health promotion and maintenance, 6 to 12% on the NCLEX exam. So some people are going to say this is easy. It's only easy if you know it. There are a lot of people in here that don't know it. So we meet people where they are on their education. All right. And then that's how we grow from there. OK, that's one thing I've learned about being an educator for almost 10 years. OK, so you guys got to realize that. So shout out to everybody that's new here. Shout out to everybody that is, trying to get in their bag in regards to nursing. You know what I'm saying? But ladies and gentlemen, if you're one of those individuals that have failed your NCLEX, nervous about taking the NCLEX for the first time, listen, I do NCLEX coaching. I have a 100% pass rate for everybody that I coach. Every single person. Why? Because I meet you where you are. You see what I'm saying? I meet you where you are. So if you're one of those individuals that you don't know where to start, know where to begin, you have difficulty, you're nervous, coaching, mentoring, in all aspects, check me out, thebootnurse.com/coaching. Fill out the questionnaire and come holler at me and let's see what's up. Let's see what you need. All right, here we go. Question 21. How many questions does the NCLEX usually have? Ashley, at a bare minimum, they will have 85 questions. The max will be 150 questions. All right, here we go. Question 21. Nurse Marie is caring for a 32-year-old client admitted with, pernicious anemia. Which set of findings should the nurse expect when assessing the client? Is it pallor, bradycardia, and reduced pulse pressure? Is it pallor, tachycardia, and a sore tongue? Is it C, sore tongue, dyspnea, and a weight gain? Or is it D, angina, double vision, and anorexia? What are we thinking? What are we thinking, ladies and gentlemen? Who said that? Somebody said something about something. Is pernicious anemia the one where they have the beefy red tongue? I don't know, Kaylin. You tell me. You tell me based off of the content that you've acquired. Do you mentor for classes and not just the NCLEX? I can mentor anybody through any part of your nursing journey, but I specifically only do one-on-one coaching for the NCLEX. All right, let's see what we got, y'all. Let's see what we got. Here we go in 3, 2, and the answer is B. Gina, we got a solid one right here. All right. So pallor, tachycardia, and a sore tongue are all characteristic findings of a pernicious anemia. Other clinical manifestations include anorexia, weight loss, a smooth, beefy red tongue, you see what I'm saying, and wide pulse pressure, palpitations, angina, weakness, fatigue, and paresthesia of the hands and feet. That's what I'm talking about, right? That's what I'm talking about. All right. Physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Remember, these questions are both for RNs and LPNs. LPNs, here's something I need for y'all to realize. Y'all have the same content that RNs learn. You just need to know what you can and can't do and what you can and can't accept. You need to know what your scope of practice is. Okay. That's the biggest difference. We all learn the same content. You just need to know what you can and can't do and what you can and can't accept. Question 22. After receiving a dose of penicillin, a client develops dyspnea and hypotension. Nurse Celestina, is that a stripper name? It's a nice name, so we're not going to say that. Suspects the client is experiencing anaphylactic shock. What should the nurse do first? What's the very first thing that you should do? All right. Page anesthesia immediately and prepare to intubate the client. Administer epinephrine as prescribed and prepare to intubate the client if necessary. Administer the antidote for penicillin as prescribed and continue to monitor the client's vital signs, or insert an indwelling catheter and begin to infuse IV fluids as ordered. Is your name Reese? Welcome. Shout out to all 543 of y'all. We're doing NCLEX questions. For RNs and LPNs, you guys can get these. They're free sets of questions from nurseslabs.com. All right. Free sets of questions. You guys go over there and check those out. Hey, we're on the road to 30,000 likes. All right. My voice starts to kind of go away. You ain't a nurse? That's cool. I didn't ask you if you were a nurse. Just answer the question. And if you're not a nurse, what do you do? What do you do if you're here? All right. I want to know what people do. It says, I thought nurses aren't allowed to intubate. You're reading too much into the question. You're reading way too much into the question. It doesn't say that the nurse will intubate. It says prepare to intubate. This is where you have to realize you got to read the effing question and also read the effing answers. Yeah, prepare. Key word, my guy. Victoria, go away. I'm gonna need for you to go away. Why? This is cramming. You don't need to be cramming. You need to be relaxing. Either I block you or you go away. Which one you want? You tell me. All right. And the answer is B. Administer epinephrine as prescribed and prepare to intubate the client if necessary. To reverse anaphylactic shock, the nurse should first administer epinephrine, a potent bronchodilator as prescribed. That's part of management of care. Management of care, ladies and gentlemen, which is the largest section on the NCLEX exam at 18 to 21%. All right, 18 to 21%. Just saying. 18 to 21%. Largest section, management of care. Delegation, assignment, supervision. What does the nurse do initially? Who do I see first? That's the largest section that you're going to see. That's the largest section that you're going to see. Okay. RNs do not intubate. All right. RNs do not have the credentials to intubate inside of a hospital. Now, if you are a flight nurse and you have the autonomy, you can intubate under the direction of a medical doctor. You're a teacher, Cynthia. You ended up here because you're a teacher, baby. That's why. And I'm also an educator, so I welcome you here. Y'all reading into the question, y'all in too deep. Listen, when I say read the question, that don't mean start putting what ifs. Or start throwing extras. That's how you'll get it wrong. Okay? Do I do the lives every day? No, I do them Monday, Wednesday, Friday, 5:30. Question 23. Mr. Marquez has rheumatoid arthritis and is about to begin aspirin therapy to reduce inflammation. When teaching the client about aspirin, the nurse discussed adverse reactions for prolonged aspirin therapy. These include, now, let's say you didn't understand that question. Read the question or rewrite the question in your own words, but don't change it to where you change up what the question is asking you, because then you're going to get it wrong. Okay. So is it A, weight gain, B, fine motor tremors, C, respiratory acidosis, or D, bilateral hearing loss? What are we thinking? Hey, remember, Also, I need for y'all to remember in the chat, you guys have got to remember that we have people that are in here that are not nurses, people that are just now starting their nursing journey, and people that have experience taking these tests, as well as who have already been nurses. All right. So don't stifle people's learning when they're trying to be in here and learning. All right. Doesn't matter if they're saying D, as long as they're saying one of the letters that are up there, not like Z or some craziness. All right. So remember that. Don't come in here stifling other people's learning experience. I will boot that ass. Mostly it's because I'm petty. But here we go. Here's our answer in 3, 2. And the answer is D. It is bilateral hearing loss. Bilateral hearing loss. Prolonged use of aspirin can cause bilateral hearing loss. Usually this adverse reaction resolves within 2 to 3 weeks after the therapy is discontinued, right? Reduction of risk potential. Reduction of risk potential. A good thing I ain't a nurse. Well, Victoria, it's a good thing that you're not a nurse, I guess. But it's okay. You got to think of ototoxicity. There you go. Ototoxicity seems to be a lot of the adverse. It does, right? Very common theme amongst giving medications for a long period of time, right? What did I say? What did I call you? Did I say something else? Did I call you? I forgot what I said. My bad. Reduction of risk potential 9 to 15% on the NCLEX exam. All right. I'm actually learning something new in here. Never stop learning. There you go. Even when you're already a nurse. Exactly, T. You learn something every single day. Is this like a final exam thing? It is a preparation for the licensing exam. You're a fool. Okay, bye. My bad, Veronica. I don't know what I did. I don't know what I did to make you dislike me. Anyways, question 24. A 23-year-old client is diagnosed with HIV. After recovering from the initial shock of the diagnosis, the client expresses a desire to learn as much as possible about HIV and AIDS. When teaching the client about the immune system, the nurse states the adaptive immunity is provided by which type of white blood cells? Is it neutrophils, basophils, monocytes, or lymphocytes? What are we thinking? If you're new here, welcome. Even if you're not a nurse, I welcome you here, right? Everybody can get their learn on in their any way, shape, or form. My name is Kevin. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. All right. And I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here? Need a review for white blood cell counts? Look at you. A or D, you don't know? Give me one. Give me one, sir. Give me one. I'd rather you get it wrong here than you get it wrong somewhere else, where it matters, like, on NCLEX or on whatever licensing exam. You have a final tomorrow. Girl, you good? You Gucci out here. Surge Tech, ATL, you want to go to nursing school? All right, to make it happen. Actionable steps. Don't tell me what you want to do. Tell me what steps that you are currently doing to make it happen. And I used to be a surgical tech. I was actually a surgical tech instructor for 3.5 years. Coordinator and all that good jazz. So shout out to all my surge techs that are out there. All right. Shout out to the Philippines. All right. And the answer is D. It's lymphocytes. The lymphocytes provide adaptive immunity, recognition of a foreign antigen, and formation of memory cells against the antigen. Adaptive immunity is mediated by B and T lymphocytes and could be acquired actively or passively. That's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. You're in X-ray school. Shout out to you. Shout out to you in LPN school and take my exit on Monday. LPN first term. Shout out to you, Jackie Espinosa. Prerequisites for ultrasound tech. Shout out to you. Sophomore in nursing school in Akron, Ohio. Shout out to Ohio. A nurse for 3.5 years, inpatient adult, surge. Okay, I see you. Says, how long are these lives? As long as I want them to be, or as long as y'all keep liking. There's that. So they can be as long as you want them to be. All right, here we go. Question number 25. Hey, so I've seen this one before and I've said it wrong. I want for y'all to put it down in the chat. I'm going to say it wrong anyway, but y'all are going to correct me. So here we go. I am an individual, in an individual with, is it Sturgeon's? Is it Sturgeon's? Oh my God. Syndrome. Nursing care should focus on what? Moisture replacement, electrolyte imbalance, nutritional supplementation, or arrhythmia management. What are we thinking? Air Force Med Tech, getting ready for med school. Love to see what I know. I love that, Dom. I love that for you. Just got my BSN. Shout out to you, Christine. Med Tech. Shout out to you. In nursing school, second semester. It's Sjogren's. Oh, okay. Sjogren's. Okay, so I said it right. Sjogren's. All right, cool. I got y'all. Sjogren's syndrome. Sound like a speak and spell over here, but that's okay. Shout out to all 547 of y'all. We're doing NCLEX questions both for RNs and LPNs. Got them off nurseslabs.com. They're free sets of questions. All right. Is it Liam and Mommy Loves Toy or Love Toys? Shout out to you, Miss Ma'am. What'd you say? You said 13 years as an RN. Shout out to you. Here we go. Preparing for the NCLEX. I love to hear it. Here's our answer. And the answer is A. It is moisture replacement. Sjogren's syndrome is an autoimmune disorder leading to progressive loss of lubrication of the skin, GI tract, ears, nose, and vagina. Okay. Moisture replacement is the mainstay of the therapy. That is part of physiological adaptation. The third largest section on the NCLEX exam at 11 to 17%. Yeah, he said, ow, yeah. Can you talk to me later? Samantha, you can send me a DM. Samantha, you can talk to me whenever. You can send me a DM. You know what's up. So physiological adaptation, third largest section, 11 to 17%. Yeah, most definitely ow. What's a good way to remember this? Study it and practice it. You didn't even know what this was? Go back and look it up and read the content for it. All right. And that way you can get a little bit more in depth. But when you study for NCLEX, you need content. You need your questions and your answers. And you also need your rationales. That rationale right there helps you retain the information that you learned previously at the beginning. OK, when you got your content. All right. Quizlet. Sure. Ladies and gentlemen, if y'all don't know who this young man is, this is my man, Antoine A.J. Ensley. He actually took his NCLEX, passed it on the 16th of February. He did one-on-one coaching with me, and my man shattered that test at 105 questions. Remember, the test is computer adaptive, ladies and gentlemen, and you could get a minimum of 85 and a maximum of 150. He got right at 105. You see what I'm saying? And he worked with coaching. I'm just saying, my man's he just got started orientation and a CV ICU. All right. And that can be you. If a coaching is what you need for that, I got you. But you need a license in order for you to do that. All right. So, ladies and gentlemen, y'all gotta keep putting in this work. All right. Do you offer one-on-one tutoring? I do. I do one-on-one coaching, but specifically for the NCLEX. All right. I took it once. It shut off at 100 for me. Shout out to you. Shout out to you. Here we go. Question 26. During chemotherapy for lymphocytic leukemia, Matthew develops abdominal pain, fever, and horse barn swelling smelling diarrhea. I wonder what those smell like, right? It would be most important for the nurse to advise the physician to order what? Is it the ELISA test? Is it electrolyte panel and hemogram, stool for a Clostridium difficile test, or flat plate x-ray of the abdomen? What are we thinking? It says, yeah, how do I sign up for the tutoring? I take my NCLEX soon. Drea, you can go to the link in my bio, look in the link tree, and you'll see the tab. It'll say NCLEX coaching, and you just follow the prompts, do the questionnaire, schedule a call with me, and we'll see what's up. All right, what are we thinking? Shout out to all 520 y'all out here rocking. We're doing NCLEX questions. Hey, y'all, I'm just let y'all know. I failed my NCLEX 3 times. I failed it 3 times. And guess what? Nobody cares. Nobody knows. Nobody cares. I told that story to people I work with. They were like, are you serious? I would have never guessed that. You want to know why? Because it doesn't matter. You failing that test doesn't matter. When you pass the test, it's what matters what you do after that. That test does not determine the type of nurse that you're going to be. Only you can determine the type of nurse that you're going to be. Everyone's timing is different. You are very right. You pass that exam when you're supposed to pass that exam. Madeline says patient care is what matters. Patient care is what matters. I agree. It says, my professor says you're still going to what? You're still going to be a nurse. That's what I'm trying to tell y'all. That's what I'm trying to tell y'all. How long do you have to wait to if you fail to retake it? It's usually 45 days. 45 days. All right. I want to go to nursing school so bad. Put it out there. Make it happen. You need actionable steps. Don't tell me what you plan on doing or what you want to do. You need to do it. That's how you get there. All right. Here we go. And the answer is C. Stool. 4. Clostridium difficile testing. Immunosuppressed clients, for example, those receiving chemotherapy are at risk for infection for C. diff, which causes horse barn smelling diarrhea. Let me tell you something. It's going to be the best smelling diarrhea you ever smell in your life. That is nothing but sarcasm. It's absolutely fucking disgusting. All right. Successful treatment begins with an accurate diagnosis, which includes a stool test. All right. It includes a stool test. I'm a nurse tech and I'm not sure if I should go all the way into nursing. Kylie, only you can decide that. You are your own worst enemy. You are your own worst enemy and you are the reason why you will not progress. It won't be no one else's fault but you. So you're telling me that you don't know if you should do it. What's wrong with you doing it? I'm going to take my NCLEX tomorrow. Call me my. You don't need to be here. You don't need to be here if you're taking your NCLEX tomorrow. This is considered cramming, and y'all already know how I feel about that. All right. So if you want to go be a nurse, put in the work to go be a nurse. What is discipline? The act of doing what you're supposed to. Or was that in the form of jeopardy? It doesn't matter. Question 27. A male client seeks medical evaluation for fatigue, night sweats, and 20 pounds lost in 6 weeks to confirm that the client has been infected with HIV. The nurse expects the physician to order what? Is it the Rosette immunofluorescent? Is it the quantification of T lymphocytes? Is it the ELISA test? Or is it the Western blot test with ELISA? What are we thinking? But yeah, y'all, like, get out of your own way. Get out of your own way. Don't know what, not one person has walked in your specific shoes to come to you and tell you what you should and should not do. I had somebody come to me, they were just like, hey, you should just switch it up. Nursing's not for you. The fuck are you talking about, bro? You've never walked a day in my shoes for you to tell me what is good and what's not for me. Huh? What are we talking about? You see what I'm saying? So if you want to be a nurse, stop playing games with me. All right? Stop coming over to my live, playing games with me, telling you, oh, what should I do? You know what you should do. It is horrible to say that. People are wild out here. So once again, if that's what you want to do, make it happen. You just failed pathophysiology. All right, cool. You get a whole day to cry to me about it. And then the next thing I'm going to ask you, what are you doing to fix that? Where are you doing? These are my own slideshows, Jordan. If you want these questions, they're off of nurseslabs.com. They're free sets of questions, okay? But the answer is D, the Western blot test with ELISA. HIV infection is detected by analyzing blood for antibodies to HIV, which form approximately 2 to 12 weeks after exposure to HIV and denote infection. The Western blot test is more than 98% accurate in detecting HIV antibodies when used in conjunction with the ELISA. It is specific when used alone. Sorry, it isn't specific when used alone. There's reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right, 9 to 15%. It's the fourth largest section on the NCLEX exam. Thank you, all the people saying D was wrong. You were wrong. It's okay. It's okay. Remember, you can't stifle everybody's education in here. All right. You can't, like, some people don't know. And if you don't know, that's okay. The rationales help solidify that, and it helps you retain that information. That's why you need content, you need questions and answers, and you need rationales. All right. Hi, it says, I passed my NCLEX last month. Thank you. It took me a whole 5 hours. That's okay. So I thought I didn't go. You thought it didn't go well. And look at that. Look at that. You passed your NCLEX. Now you're a nurse. Congratulations to you. Welcome to the shit show. If you could give a piece of advice to anybody studying for the NCLEX, what would it be? I'm getting educated here. I love that. I love that you're getting educated here. All right. This is actually the good and right side of TikTok, right? Question 28. A complete blood count is commonly performed before Joe goes into surgery. What does this test seek to identify? All right. Is it a potential hepatic dysfunction indicated by decreased BUN and creatinine levels? Is it low levels of urine constituents normally excreted in the urine? Is it an abnormal low hematocrit and hemoglobin levels? Or is it electrolyte imbalance that could affect the blood's ability to coagulate properly? What are we thinking? Shout out to all 400 plus of y'all. Hey, give me the 40,000 likes. Stop playing games with me. I love y'all. All right. Make sure you smash that like button. You guys follow, you guys share. Turn on the notifications so you guys know when I do these lives too. Sometimes I do impromptu ones, right? But got these questions off nurseslabs.com. They're both for RNs and LPNs for NCLEX, all right? And they also do care plans over there if you're a nursing student in a nursing school, okay? You guys can go over there and check those out as well. I saw somebody in the chat say something about, thank you for being real. I gain nothing from lying to you. I gain nothing by sugarcoating it, because when you get out here and you start working as a nurse, I'm telling you right now, these hospitals don't give a fuck about you. They don't. I'm telling you right now. So I'm telling you right now, get into the mindset of taking care of you and taking care of your license and taking care about what you are fighting for. Thank you for the rose, you think? So I'm just letting you know. The website is nurseslabs.com. So you need to get into that mindset of being like, hey, you about this work and you taking care of what you have. But the answer is C, abnormally low hematocrit and hemoglobin levels. Okay, reduction of risk potential 9 to 15% on the NCLEX exam. Lemon poppy. I can't even believe I just said that out loud. I'm just going to call you lemon because I will not call you the P word again, sir. Poppy. All right, here we go. Question 29. While monitoring a client for the development of disseminated intravascular coagulation, the nurse should take note of what assessment parameters, right? Is it A, platelet count, prothrombin time, and partial thromboplastin time? Is it B, platelet count, blood glucose levels, and white blood cell count? Is it C, thrombin time, calcium levels, and potassium levels? Or is it fibrinogen level, white blood cell count, and platelet count? What are we thinking? What are we thinking? Shout out to all y'all out there rocking. I want to know who you are, where you're from, where you're at in your nursing journey. If you guys are just now joining, we're doing NCLEX questions both for RNs and LPNs. All right. Nurses, meaning more than one. Labs, also meaning more than one. .com, meaning the interwebs. Nurseslabs.com is where you guys can find these questions. Can the RN provide the patient with their lab results upon request, not interpret, but just provide? So Taylor, that's a good question. RNs can interpret labs because it is in their scope of practice to do so. They can do that. And they can provide their labs as well if the labs are available. Not in the medical field, but it's highly interesting. I love it. Ma'am, I'm glad that you love it. I'm a paramedic student. I'm here just to learn more as for further my education. I love that for you. Hey, by the way, if I have anybody that's in here that's going paramedic, go check out my girl. Her name is Medicate. Like it's spelled Medi and then with a K, Kate. And she actually teaches paramedics how to prepare for the NREMT exam. So you guys can go over there and check her out as well. Okay. But here we go. And the answer is A, platelet count, prothrombin time, and partial thromboplastin time. The diagnosis of DIC is based on the results of laboratory studies of prothrombin time, platelet count, thrombin time, partial thromboplastin time, and fibrinogen levels, as well as a client history and other assessment factors. That is part of reduction of risk potential. Reduction of risk potential, which is the fourth largest section on the NCLEX. Fourth largest section on the NCLEX. Fourth largest section on the NCLEX. At 9 to 15%. Y'all, I just pinned somebody. I'm just going to start doing that from now on. But Shayna, congratulations to you. Welcome to the greatest shit show on earth. Welcome to being a nurse. You are a licensed practical nurse, ma'am. Welcome to being a nurse. Don't let nobody disrespect you. All right. And also don't you disrespect nobody else either, because, we got scope of practices and this is how we do things around here. But congratulations to you. If there's a piece of advice that you could give to anybody preparing for the NCLEX, what would you do and what would you give? Shout out to you. Lemon Poppy. Congratulations to you, sir, for passing the USMLE. I don't teach that. I don't know nothing about it except for that's what you need. So shout out to you. All right. Here we go. Question 30. When taking a dietary history for a newly admitted female client, Nurse Lynn, not a stripper, should remember which of the following foods is a common allergen. Is it bread, carrots, orange, or strawberries? What are we thinking? Shout out to all 400 plus of y'all. I appreciate y'all listening to my antics. We can get funny up in here. You know what I'm saying? We can get real funny. Shout out to y'all getting me 40,000 likes and all the shares. I appreciate you. Lemon, sir. Poppy. Appreciate the roses. Appreciate the roses. Thank you, sir. All right, y'all. I'm going to give you guys 10 more seconds. Strawberries. Is it CEO or CO? Thank you for the roses. Appreciate you. Gina, don't judge me. All right, y'all. Here we go. Y'all. Here we go. Here's our answer. Here is our answer. And 3, 2, lemon, sir. There you go. And the answer is strawberries. Common food allergens include berries, peanuts, Brazil nuts, whatever, cashews, shellfish, and eggs. All right. Basic care and comfort. This is something that you guys learn in foundations of nursing or fundamentals of nursing, right? That's exactly where you learn, right? Basic care and comfort. 6 to 12% on the NCLEX exam. Oh, I got a paper crane. Shout out to you, Emily. Never got one. Boy, mom, thank you for the roses. I appreciate you. All right. So shout out to y'all that got that right. And of course, if you got it wrong, hey, You know what you need to do. Circle back and get it right. I watch every live every chance I get. I log on, share your videos. Shayna, thank you. I appreciate that. You keep sharing them. Keep sharing them for people. Ladies and gentlemen, as we circle back, hey, I got a free test taking tips. I got a victory guide, an ebook, 700 pages, y'all, of greatness. Y'all can go over there and check out. 7-day NCLEX course. You can join that program for $7. And then after the trial, it goes up to $48 a month. All right. And also, if you're looking for one-on-one coaching specifically for the NCLEX, you can check me out at thebootnurse.com/coaching. Little Crown, thank you. You think I appreciate you, Miss Ma'am, and your 7. Hey, let them, Shayna, let them know about the 7-day NCLEX course. Let them know. Let them know. And ladies and gentlemen, that wraps up our session today. You are a good teacher. You should teach USMLE. Look into it. That's for medical doctors, and I have an issue. I have an issue with the US. With if I had to teach it, I'm not a doctor. You know, a doctor should be teaching that. You know, that's just my thought, though. You know, but I appreciate that. We got to all the questions, y'all. I appreciate y'all participating. I had to ban some people. I forgot their names because they're unimportant now, and y'all know that I'm petty and I like talking shit about people. So there's that. There's that, ladies and gentlemen. So I appreciate you guys being here. Nurseslabs.com is where I got these questions from. Ladies and gentlemen, the 7-day NCLEX course is $7 for you guys to join. We have a community in there. I did a live lecture today on pediatrics. So if you jump in there, you guys will see that pre-recorded video. Okay. Check that out at thebootnurse.com/special. I got that free download, 42 pages of amazingness, right? Make sure y'all go get Conquer It. It's coming out on June 5th. That's my 4-year nursing anniversary. 4 years, 2 years it took me to get my license from failing 3 times and then me passing June 5th of 2020, right? I want my story to captivate and to motivate you, not just to get your NCLEX, but to go through and conquer with whatever the fuck you got going on. So make sure y'all go check that out. That link is in my bio, okay? And then, of course, if you want one-on-one coaching for the NCLEX, you guys can check that out at thebootnurse.com/coaching. Ladies and gentlemen, how y'all doing? First of all, back it up. Back it up. Y'all are all up in my face, right? But what y'all doing? How y'all doing? You know what I'm saying? Hey, if you guys are new here, this is me, Kevin, the boot nurse. All right. Been a nurse 3.5 years. You know what I'm saying? Been a nurse for 3.5 years. Worked ICU, worked OR, worked PACU. And I've been teaching for 9 years. I was an instructor, a master instructor in the Navy. I taught so many different programs, and now nursing is where I do all this education aspect of, right? Have I done travel nursing? No, I have not done travel nursing. I planned on doing it, but then, had some unforeseen circumstances that happened to me in life, and I just didn't want to travel anymore. So I heard that's where the money is. That technically, yes, that's where you can make a lot of money travel nursing, but you got to be smart when you do it. And here's another thing, for my doctors that are out there, if you want to do travel doctoring or what they call locums or something like that, you could be a traveling doctor. Same concept. Same exact concept you guys can be a part of. We can be traveling doctors, okay? Model says, I hope we can make these lives more often. Hey, my lives are Monday, Wednesday, Friday at 5:30 all the time. And I've been doing this it'll be a year, I think, next month, or a year in April, one of the two. So, yeah, you didn't know that? Look, hey, Lemon, listen. Lemon. Poppy. Hey, listen, bro. Look it up. It's locum. It's LOCUM. Type in locum doctor. You know what I'm saying? And then you'll see exactly what I'm talking about. Yes way. I'm just saying. So there are so many opportunities out here, right? And I'm everybody's mentor. As long as you want me to be, especially if you're a nurse or if you're military or anything, I'll be your mentor for whatever you want me to be. So those are the things that you can look into. Don't ever say you came to this live and you ain't leave with something. You know what I'm saying? Stella, you're welcome. Model, you're welcome. But of course, I want to know, y'all got me to 40,000 likes, so I appreciate y'all. So who are you guys? What do you do? Where are you at in your nursing journey? Some of y'all I know, some of them I don't. Make sure you guys smash that like button. Where are you at in your nursing journey? And what questions do you have? What other questions do you have? I mean, my first semester is 5 years at normal pace. It took me 8 years to become a nurse. It took me, Dovey May, it took me 8 years to become a nurse. 8. Shout out to Ghana. I start my LPN program on Monday. Thanks for the section. You're welcome. First semester in nursing school. Shout out to you, Hilton. Med math. Hey, it's a part of the journey. You got to, practice questions. Practice. Studying for the NCLEX is so overwhelming. Jocelyn, start with the hardest section for you. So if it's pharmacology, start there and then work towards the easier sections that you know. All right. Graduation this Saturday. Shout out to you. Hey, boy, mom, get into that ICU. I love to see it. All right. Graduated nursing school in December. Just started my first job. I take the NCLEX in 2 weeks. Shout out to you, Frankie. Shout out to you. All right. Student level 5, graduated in May. Is it Bree? Shout out to you. I just finished my LPN program in 2 months. I finished my LPN. Okay, I got you. Hey, it's right around the corner from Kenya, but in England. Shout out to you, Marie Q. I graduated in August. I'm scared to take my exam. Jocelyn, let me tell you something. That exam has no type of emotional ties to you whatsoever. None whatsoever. And guess what? If you fail, and yes, I always put it out there because it's always a possibility. If you fail, you can take the test again. Don't be scared of it. And if you want to ease your anxiety, prepare on how the exam is going to be. Recreate the testing center, computer, questions and answers, content, no phone, no drinks, no snacks, no nothing like that. Focus on the task at hand. Train like you fight, okay? The link again for the free class. What free class? What are you talking about? Because I feel like I never know enough. You're not going to know everything, Jocelyn, and that's okay. You're not meant to know everything. Even if you did, they're going to start throwing out really hard questions and you'll be like, what the hell is that, right? Just graduated in Jan, passed my NCLEX this month at the age of 50. Melly Mel. Let them know. Let them know. Your age ain't got nothing to do with nothing. They ain't got nothing to do with nothing. First of all, congratulations to you on passing the NCLEX. Congratulations. Welcome to the greatest shit show on earth, known as being a nurse, whether you're an RN or an LPN. And of course, if there's a piece of advice that you would like to give, what would that be? How many times can you take the NCLEX? It depends on the state that you're in. So some places like Ohio and I think Missouri and Pennsylvania, like you have unlimited times that you can take it. Places like Florida, you can only take it like 3 times. I think California is 3 times, so on and so forth. Do you recommend any direct entry MSN programs? I recommend you getting into nursing in any aspect of what you want to do. Now, here's what I'm going to tell you about the direct entry master's programs is they set you up in the aspects of leadership. Now, if you go and get a master's degree in something and then they put you in an administrative level where you're running a floor where you've never ran a floor before or even nursed, that's where you're going to have a problem with your colleagues. You see what I'm saying? They're going to look at you, and I'm telling you, because it happens all the time. Who is she or he to be in a leadership position running a floor if they've never done patient care? You see what I'm saying? So, do I think that they're bad? No, not necessarily, but you got to know how to move. Remember, people are envious of how people move, but you got to be realistic. Like, if I was working in the ICU and you're telling me what to do in the ICU and you've never worked in the ICU, you and I gonna have a problem. You and I are gonna have a problem. And yep, we're gonna have a problem. You see what I'm saying? So, there's just those things to think about. What are your thoughts on CNAs? I love CNA. Hey, if you're a patient care tech, CNA, a medical assistant, X-ray, PT, lab, pharmacy, whoever at the surgical techs, at the technical level, I fucking love y'all. Y'all are appreciated, and I don't ever want you to think that you're not appreciated. If y'all don't ever hear it from anybody, from me, from Kevin, everybody's mentor, right? That I appreciate y'all and everything that y'all do, even if it goes unnoticed. People don't tell them that enough. They don't tell y'all that enough, and I'm telling y'all that right now. You are even if it goes unnoticed. People don't tell them that enough. They don't tell y'all that enough, and I'm telling y'all that right now. You are. It says, thank you. You're welcome, Cheryl. I got you. It doesn't matter. I have incompetent supervisors and they're still in those positions. Hey, is it Hillen? D Hillen? I don't disagree with you because I've seen it happen in one of my ICs. I've seen it happen. However, I'm just saying for your sake, mentally, don't do it to yourself. I just thought it was silly to pay for a second degree completely out of pocket. No, I mean, you have a bachelor's degree, but if you want to get a master's degree in something else, you have to go that's the route that you would want to go. I want to start as a CNA. Cool. You can start wherever you want. A lot of people start at CNA just to see if they're even going to like the medical field. And that is okay. You'll have other people tell you, oh, girl or guy, you're stupid. You should have went this route. Hey, fuck them. They're not you. They're not you. You know what I'm saying? So move in the way that you feel that is best for yourself. Being a CNA is not a bad way to go to understand if medicine is where you want to work. Okay. I'm a MA certified and I want to go back to school to become a nurse. Then go back to school and become a nurse. Simple. You guys are our eyes and ears for our patients. Facts. Geraldine, let them know because they are. They are. All right. What would you recommend for a first year nursing student? Leslie, that don't even like what do you mean? Like what do you mean? What would I recommend? You gotta give me more context into your question. Hey, if you guys are new here, welcome. We did NCLEX questions for RNs and LPNs. I'm gonna hang out here answering some of you guys' questions and gals of your questions in regards to nursing, NCLEX, first year aspects of being a nurse, getting into nursing school. Like I went through that whole journey. I know how it all goes, right? So whatever questions you guys have, I will answer them. But yeah, Leslie, you got to give me a little bit more context in what you're asking. It says, how do we access the NCLEX Victory Guide? So the NCLEX Victory Guide, you have to purchase. You can go to my website. You can find it there. If you decide to get the 7-day NCLEX course, you can get that where it's an add-on. But the Victory Guide itself, it's the NCLEX, I'm sorry, it's thebootnurse.com/victory, and it'll take you straight to that page. How do I access that? Yep. Is it ever too soon to start preparing for the NCLEX? Yes, I believe there is. In my opinion, you really shouldn't start studying for NCLEX. I mean, like super heavy for NCLEX until it's like your last semester of school. Become familiar with it because you're going to have to become familiar with it throughout school. But your first semester, you're not even going to know what even the nursing concepts and all that stuff are. So that's when I would say it's too early. But throughout nursing school, you need to be becoming familiar because those ATI tests, those HESI exams are going to be NCLEX style. Okay, so that's what I would say to you. May, you are welcome. It says, is your one-on-one mentoring different from the 7-day class offered? So the 7-day NCLEX course is a self-paced on demand. So you do that on your own. I have lecture videos that are up there where I go over questions and answers, and then you also have access to content. Now, the mentorship is one-on-one is just like this. Instead of me talking to 86 of you, or sometimes 500 of you, it's just one-on-one where we talk for you get at least an hour, but on average, it lasts from an hour and a half to 2.5 hours, depending on what you need. And you get that for at least, you get that for 30 days or for however much you need. Some people need 2 weeks. Some people need 30 days. Some people need 60. Some people need 90. So it all just depends. All right. What advice do you wish someone would have given you as a new grad? To not rush the process. To not rush the process. And to go to a level 1 trauma facility where they teach. That's the advice that I wish I would have taken. And some of the advice I wish people would have told me was to slow down and trust the process and not rush through it, not worry about money because the money is going to come. And then also I wish I would have taken a few people's advice and gone to a level 1 trauma facility, but I didn't do that. I followed the bag, and the bag it burned me out. So I'm a repeat test taker. Embarrassed to say. You're not embarrassed to say it. You just said it. Don't be embarrassed to say that you're a repeat test taker. Wear that shit on your sleeve like a badge of honor. You want to know why? Is because that is how you succeed, is by being unsuccessful. I failed my NCLEX 3 times, lovely R. I don't know if you're new here, and I don't know if you know that story, but I failed my NCLEX 3 times. 3. And I gladly wear it on my shoulder like a badge of honor. You want to know why? Is because I didn't quit. I still persevered. I still motivated myself. I still got over all those trials and tribulations. And then I became a registered nurse, and I'll be a registered nurse 4 years in June. Don't nobody care. Nobody's ever going to ask you. You see what I'm saying? And don't be desperate for a breakthrough. You need to put steps in place in order for you to get over that hump. And I can help you with that if that's what you want, like one-on-one coaching. Or, of course, you can look at the course or stay here on TikTok and hang out with us and get that knowledge that way, whatever you need. I feel like the ATI is way easier. I feel like the ATI is way easier than the nursing school exams. I don't know. I couldn't tell you. I've never used ATI. What's the name of that app that let you study for 2 hours without interruption? Huh? I don't even know what you mean. Are there schools that don't kick you out for getting less than 100 on a math exam? That all just depends. If you're talking about the math exam, such as for dosage calculations, there are some schools that say you have to get 100%, some that say 80, some that say 90. My school was a 90% or above. Other ones, not so much. All right. And there are schools that are out there that are like that. Don't feel embarrassed. I was to get back in there. Get off your island. Geraldine, it's get off your beach. I love where you're at though. I love where you're at. You're such a positive and motivational speaker. Is it TX? Hey, I appreciate it. Get off your Normandy. Geraldine, you know what's up. Hey, Geraldine is a frequent flyer, y'all. She knows what's up. She knows what's up, right? Geraldine, I appreciate you being here. But TX, that's exactly why I'm releasing a book. That's exactly why I'm releasing a book. Everybody knows, if you don't know my story, I am a Navy guy. I got out of the Navy at 16 years, just this past January. So it'll be almost 2 months that I've been out of the military. And you learn so many trials and tribulations going through the service. I've been on 2 deployments, one to Guantanamo Bay, Cuba, and the other one to Afghanistan, part of a forward surgical team. I did medevacs, I did casevacs, I did life limb, eyesight. I did all that stuff. So, we live and we learn, but you got to get off your beach. If you understand the beaches of Normandy during World War II, either 2 people stayed on the beach, the dead and those that were going to die. So I use that analogy. I use that analogy all the time. So what do you want to do? Who said that? Was that lovely R? I'm picking on you right now, if you're still in here. What do you want to do? Do you want to stay on your beach and not progress? Or do you want to look fear in the face? Do you want to look at all those rounds that are being rained down on you, such as life? And do you want to run through it? Either way, you're going to be scared. If you're scared, go to church. And if you're scared, you're going to run through life anyway. You're going to run through all that gunfire, right? But guess what? You're going to progressively be going forward. So once again, what do you want to do? Thanks for motivating me. Curvy Mom, I will motivate you as much as you want me to. I'm everybody's mentor. I am everybody's mentor. Whoever wants me to be there, I'll be there. Because I got mentors that motivate me. So why would I not motivate y'all? Make that make sense. All right. Thanks to you. I have such a positive influence. I love that, Geraldine. I love that for you. ATI is harder for me. Once again, to each their own. ATI, HESI. I hated HESI. It's not everybody's cup of tea, right? ATI is harder for me. I currently trying to pass my green light so I can take the PN. Any tips? With ATI, it's whatever those programs are. And starting with the hardest sections. Like, you want to study the hardest sections because those are the ones that they're going to throw at you. Still trying? Hey, you're not going to still try. You're either going to. So in the words of Master Yoda, do or do not. Because there is no try. Cannot hear me? Can y'all still hear me? It says, do you think a year bridge BSN program is harder for a working mother? First of all, no one cares if you're a working mother. Everybody has a sad story. Number 1. Number 2 is I went through an accelerated BSN program while working a full-time job. I was full-time active duty as an instructor going through nursing school. You see what I'm saying? So, do I think a bridge program will work for you? Absolutely. Other people have done it, so what makes you think that you can't do it? A lot of people will start using their aspects that they have in life, such as, I have 2 jobs, or I'm a working mother. Okay. So you're a working mother. Cool. So do you still want to do that bridge program or not? Now, what I will tell you, a bridge program to a BSN program, to do a BSN program in a year is hard. It is a lot, but it's doable. There's going to be a lot of time management that's going to be on a lot of people's parts, mostly yours. So you can also look at other programs that are not as fast. You can also look, everybody is such in a rush to get there. And I used to be there. I used to be that person. But I'm going to tell you right now, trust the process. If it takes you a year and a half to get through nursing school, that's okay. If it takes you 2 years to get through nursing school, that's okay. You are right where you are supposed to be. Remember that. It says first time here on your page and live. Lovely R, I love that you're here. I can hear you. Good. I'm okay, cool. things are going to run through your life whether you are a nurse or not. Stay going. Facts. You got to keep going. You got to keep going forward. Hey, if you guys are new here, welcome. We did NCLEX questions for RNs and LPNs. We do them Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. El Paso's on Mountain Time, so we kind of give them some leeway. You know what I'm saying? But what questions do you guys have in regards to nursing, taking the NCLEX? A lot of people ask me about military nursing. I talk about that as well. I wasn't a nurse in the military, but I mean, I haven't said anything that's incorrect about nursing in the military yet. So until I do, I guess, people can fact check me. So what other questions do you guys have? You guys were hitting me with the questions. You know what I'm saying? If you guys don't have any questions, you already know that your boy can go, because he has some content that he got to make for the 7-day NCLEX course. He got some stuff that he got to do for the book. We got a bunch of stuff going on. So what questions do you guys have? What do we got? Let's see what's going on here. All right. Let's see. All right, well, I think I might just go ahead and call it a night then, since I don't have any other questions. Of course, before I leave, I already told my beach story, right? It says, I'm not sure what you offer as far as a review. Do you have a discount code? I don't. I don't have a discount code, but right now I do have a limited offer in regards to joining my 7-day NCLEX course. You can find that link in my bio, or you can go to thebootnurse.com/special. As a matter of fact, do you want to see what it looks like? I'll show you what it looks like real quick. If you want to know what it looks like, let me know, and I'll turn this camera around. That way you guys can see it. If you guys want to see it, just let me know, and I will show you what it look like. Yes, it says, where do I pay $7? Tried finding in your bio, Geraldine. So if it's not working, I'm gonna pull it up right now so y'all can see it. So give me 1 second. Money, there it is, right? So we will go here, right? So this is what the 7-day NCLEX course will look like. It says where I went in person. I don't know what you're talking about. What we're talking about. So here we go. This is what the 7-day, this is what it looks like once you are inside of the course, okay? It says, is the Baptist Health System a good for nursing school? I actually don't know. I do know a few people that went through there, and I never heard them complain about it. So I wouldn't think it'd be a terrible system. I mean, I know that they're going to tell you to turn right back around and work for them, which is fine. But so anyway, so here's a 7-day NCLEX course right here, right? So over here towards the left, I have all the content. First off, I start you guys off as if I don't even know you, right? So we talk about computer adaptive testing, the passing standards, so on and so forth, and the testing plan. Do you critically think? Learn how to do that. And then, ladies and gentlemen, we jump right in to the 7-day review. Day 1, all I ask you is give me an hour to 3 hours out of your day. And by that, this is an on-demand video. It's on demand, right? You can do it whenever you want. Whenever you want. Look at that, 30 minutes right here for the first video, right? And then as we go into it, here, let me mute this. As we go into it, we talk about, what the topics are, okay? Talk about what the topics are, then we jump into the questions, right? And then I tell you to pause the video, read the questions, select your answers. I even give you the topics. You want to know why? Is because by understanding these questions and narrowing down the topic, it helps you formulate what direction you should go in regards to answering questions. All right. Hold on 1 second. It says, do you recommend doing the 7 days before my exam? I recommend you doing the 7 days and then giving yourself at least like a good 30 days, because and another thing that I would recommend is getting yourself a set of NCLEX questions, because the questions not only will help you, they will show you where you need to improve on. All right. January right now, it's $7 to join the 7-day NCLEX course. And plus you get to be a part of the community. And then after 7 days, it goes to $48. It says, what is the ideal time frame you recommend to finish the 7-day NCLEX course? I'm interested. So I think that you could give yourself honestly, I will always tell somebody to give themselves 30 days. I will always, my default will always tell you 30 days. Unless people prove to me, and that's usually when I'm working one-on-one, when they prove to me that they can do it faster than that, then that's totally different. That's a totally different story, right? So we go into questions, we read them together, and then also, see if it pops up here, which it does not. So, we go through these questions, and then, let's go to management of care. Management of care, y'all, largest section, right? And then I even go over a case study. I know that's kind of small for you guys to see, but I go over case studies, right? And then guess what? With the case studies, those are going to look kind of familiar. Are they not? Smash that like button. You know what I'm saying? Let me know down in the chat if these things look familiar to you. If they won't, I'll turn around, turn it off, and I'll go on about my business. All right. So, we go over case studies in here, right? Talk about specifics, right? Your closed and your drop down type of questions, right? As well as, let me go back. We have our what's indicated, not indicated, right? We have our clinical findings. Which one does it fall under? HHS or DKA. That's part of your endocrine system, right? We go through more. Look, we have more closed down, drop down, right? We go through those. We have more, and got to think about it with case studies inside of the course. You have access to the course for 30 days. Oh, it says, how long do I have the access to the course after paying? So you get it for $7 for 7 days. And then after that, it's $48 monthly. All right. And so look, this is another one. We have, based off of the clinical assessment findings, based off of our case study, did they improve? Did they change, or did they worsen? And the whole point is, the great thing about it being on demand is that you could pause it, go back, read, understand, right? Putting things in order, right? And this one right here is management of care. And I go over 30 questions, right? I think 30 questions is, I think that's plentiful. I think that's enough, right? So that's what that aspect looks like with the 7-day review, right? And then also I have a next generation or a new generation NCLEX review, another review that you can go through. This is where these are all randomized questions, right? But they're not they're all over the place. And by all over the place, I mean that they're mixed up from the 8 client needs section of the NCLEX, okay? And so the reason why it says 2023 is because, ladies and gentlemen, that is when the NCLEX updated the NCLEX test plan, and it's still the same one. Okay, so, and we go over questions. I talk about the changes that happen, the test structure, all that stuff, the length. Then we jump into questions. And there are 8 videos just for the next generation NCLEX review, right? Or the new generation NCLEX review, right? These 8 sections right here make up 4 hours. 4 hours of content. I'm sorry, 4 hours of a review. Right? Look at that case study, right? Let's see what some other ones that are in here. That's another case study, right? What is this talking about? What disease process do these findings fall under, right? Talking about preeclampsia. I know that looks familiar, right? Talk about another case study. These are ones that are like for when you have to do your highlights, because you will have questions that are highlighted ones, right? Let's see if I can find another one. You'll have your matrix, not your matrix. I'm sorry. You'll have your bow ties. Let's go back. Right. You have your bow ties. Right. So those are things that you can look at as well. All right. It says, hi, I'm an international educated student. I will be sitting for the NCLEX in May. Which course will you on your program? Will you recommend me to wrap my knowledge? I'm trying to make sure I understood that, Abdullah. So if you're looking for a course, like I said, like with my content with this review, I break questions down. And then down here, over here on the left, I actually go over on content, right? I call this the NCLEX content vault. So if you're a repeat test taker like Lovely R, this is a video that is pertinent. It's wonderful for you. It's 26 minutes long. You can download the PowerPoint. You can go through it. You know what I mean? And so I talk about it because this is near and dear to my heart, because I failed my NCLEX, right? My video even gets bigger at one point where I start telling you guys like, hey, get it together, right? And then over here towards the left, what else do we got? We got more. Well, we talk about time management, creative ways to study, a study plan, creating a study plan for yourself, lab values, legal rights, delegation and supervision, which is huge, management of care, right? Pharmacology, y'all, there are 18 videos right here for pharm. 18 content videos, including how to do dosage calculation. All right. As well as you scroll down, I have fluid and electrolyte imbalances, right? We talk about hyper, the kalemias, natremias, calcemias, magnesiemias, DVTs. I'm actually working on content right now for AFib, A-flutter, VTAC, VFib, supraventricular tachycardia, like all these things. Is this free? No, it's not free. This is not free. And endocrine system. And I'm working on more content videos that are going to be going up in here. Okay. Is it Eris Anderson? I do a free, review at the end of this, or not the end of this, but I usually do a free review Monday, Wednesday, Friday at 5:30. So, yeah, that's where I do that here on TikTok. But this is my course, the 7-day NCLEX course, where I break down NCLEX style questions, such as we'll go to pharmacology. And these are questions that are strictly based around pharmacological and parenteral therapies, right? You guys see my glorious face that's down here at the bottom, right? And then we talk about, those types of questions, right? Tell you one, like select all that apply, right? And then we even have some more ones with some findings. There's another one in here. It's over here somewhere. And there's a case study in here as well. I actually love case studies because they give you a lot. They give you a lot of information. So here's a case study that's right here with all the information that you need. And I'm reading these questions out to you guys as well as you guys are listening, right? And then, of course, you'll get your follow-on question based off of the information that you got inside of your case study, okay? The 7 days has all of this, or do you have to preview a full course? What, lovely R, I don't know what you mean because your words are kind of mixed. And paid at where? What do you mean, Geraldine? What do you mean? And then also something else that everybody that gets the course, you're typing quick. All right, well, you ain't got to type quick. I ain't going nowhere. I'll wait for you to answer, right? So down here, you guys can actually join and be a part of the community, right? So this is actually a community that I created, right? Where there are people that are in here. And of course, hey, welcome to the Nursing NCLEX community. This is actually a part of the 7-day NCLEX course. Will this help LVN's exam? Natalie? Yes, it will. I'm sorry. If you ever seen The House Bunny, you know exactly what I'm talking about. So you can come down here. There's a welcome page, tells you everything. And then, of course, once you do the community, if you want to go back to the content, you just come back down here and click and it'll take you back over there. Okay. And then we come up here to the latest post where we have people that are posting. I have stuff over here that is towards the left where, we have general conversations, you introducing yourself, and then, of course, your wins. Okay. And then over here, we do meetups. And today I did, if you guys can see it right here, I did a lecture on pediatrics for NCLEX. That was a live lecture review that I did. I do motivational Mondays. I did one last week for fundamentals of NCLEX. So all those good things, right? And then, of course, there's challenges over here. And with the challenges, I give you NCLEX style questions that you can answer every week. I'm working on a prize to give people that get it right every week. It's actually another study guide that I'm working on. And then, of course, down here, I have the EKG, ECG challenge where I will give you a heart. I'm going to show you right here. I'm going to blow it up. I'm going to give you a heart with a rhythm strip. A heart with a rhythm strip. And you guys got to tell me based off this rhythm strip and the electrical conduction that you're seeing right here, what cardiac dysrhythmia that is. Okay, and only one person answered right here. And so if you get picked if you get this question right, and if because the winner is picked at random, if you get picked, you get a one-on-one coaching call with me. And my coaching calls last for anywhere from an hour and a half to 2.5 hours. So that's something else that you guys, sorry, I know that's blurry. That's something else that you guys can check out as well. It says, do they show a lot of rhythm strips on the NCLEX? It depends. When I did the NCLEX, I had, I think, 3 or 4 on my last time I took it. But you want to be prepared. You want to know what they look like. You want to know what they look like, and you want to know what signs and symptoms that somebody is going to display when they have any type of cardiac dysrhythmia, such as AFib, A-flutter, VTAC, VFib, right? What medications I need to give, so on and so forth, all right? It says, do you have access to all of this for $7 for 7 days or only a preview until you pay in full? No, you get it. So once you pay $7, lovely R, you will have access to all of it. You'll see all the content over there. and to include the review, as well as you'll have access to the community. You have access to the community. So if you decide to jump in now, I would put it this way. If you want a chance on doing a one-on-one coaching session with me, you have two. If you jump into the 7-day NCLEX course right now and you jump in and you fill out this EKG challenge and it picks you, then hey, we're gonna schedule a one-on-one call. And I'm also gonna do live Q&As inside of here as well, where I'll actually pull you up and we'll have a conversation. It'll be a recorded session. Also, I'm gonna start people that pass the NCLEX. I'm gonna be bringing them in here, and I'm gonna want them to tell their stories and how things worked for them. Okay. Kel says that's dope. Then $48 after the 7th day. Correct. As of right now, the way that I have everything set, correct. $48 after the 7th day. So if you decide to leave it alone and not touch it, it'll just $48, and then it'll be on a monthly subscription, like Netflix, right? So any tips for remembering any tips on remembering treatments for different rhythms? So, I have actually a lecture where I go over cardiac medications, where it talks about our ARBs, our ACE inhibitors, beta blockers, calcium channel blockers, digoxin, diuretics, anticoags, and antiplatelets, nitroglycerin, so on and so forth. Depending on what's going on with your heart will depend on the medication that's used, right? And when you're learning these medications, a lot of the medications have the same signs and symptoms. You need to know which ones are inotropic, chronotropic, and dronotropic, right? Which ones make the heart stronger to contract, and which ones are dronotropic, which cause the heart to relax, right? So if I'm having a heart that's freaking the hell out, I need to get it something that's going to slow the heart down, right? So think about those things right there. Where do I sign up? So as a matter of fact, I'm just going to do this so everybody can see it. So I'm going to turn this around. All right. So right here, if you guys are looking to join the 7-day NCLEX course, you guys can go to thebootnurse.com/special, and you guys can get it there. All right. Also, if you guys go to the website, you guys will see where it says NCLEX freebie. That's a free download. It's 42 pages. You guys can go over there and check that out as well. There was another way they said that you can, I can't do mirror video. Oh, that's dumb. I was going to do mirror video, but it won't let me do it. So that's dumb. But yeah. So you guys can go over there and check that out as well. And so if you guys are new here, I usually do questions and answers, and I get my questions and my answers off of nurseslabs.com. They're free sets of questions. And I got them over there. But my NCLEX review is nothing like those questions. Those questions are a lot more in depth. The rationales are a lot more deeper. But remember, with nurseslabs.com, they work for people. They work. Thank you. You're very welcome. May. So you guys can go over there and you guys can check out the 7-day NCLEX course over in that direction for yourself as well. Okay. What other questions do you guys have? I'm going to hang out for about another 5 minutes. Of course, you guys go check out all the videos that I post on my regular page at The Boot Nurse. You guys can go check me out over there on the YouTubes. It's at The Boot Nurse as well. You guys can go over to thebootnurse.com/books, and you guys can pre-order Conquer It. That's my book, my motivational and inspirational book that's going to be coming out June 5th, which marks my 4th year of being a nurse. All right. I did see somebody on here that was asking how long I was a nurse. I don't know if they're still on here. They're probably not, but I don't know where they went. Nah, I guess it doesn't matter. If you're not on here, no, you're not on here no more, and that's fine. So, but what other questions do you guys have? What other questions do you guys have? I'm turning this camera back around, hang out for about another 5 minutes. Yeah, your boy got a lot of stuff that he got to do. So, of course, hey, if you pass NCLEX, hell, if you pass anything, I don't care what it is, come over here. Let us celebrate you. If you're inside the 7-day NCLEX course, go into the community and share your wins. I don't care what it is. If you pass a test, if you started doing really well on your practice exams while you're trying to study for NCLEX, I don't care what it is. You pass NCLEX, I want it in there. right? Let us celebrate you. Let's celebrate each other. That's, you know, like, no, hey, here's the thing. Normalize celebrating people's small wins. Hey, if you pass in 85 questions, cool. But let's normalize people passing at 150 questions. Let's normalize people passing in general. Let's also normalize that people are going to fail and it's okay. Let's normalize that. But what's not okay, and something that I will never, ever normalize, is for the fact that you're going to quit. I'll never say it's okay for you to quit. Never, ever, ever. Ever, ever, ever. You came to the wrong place if you think that I'm going to let you quit. Unless it's alcohol, because, you know, that's nothing positive for your life. For the 7-day review, it says the page doesn't exist. What you talking about? I just tried to register. Did you go to thebootnurse.com/special? Because let me see, because that can't be right. That cannot be right. No, it's right here. I see it. They say I may have mistyped the address, or the page must have been moved. So it is. Hold on a second. Now, see, now I got to check my back end to make sure, because somebody just got it. The page, it says I couldn't get through either. Okay, let's see. Let us see what the issue is. Thank you guys for telling me, because if I don't know these things, I can't fix them. And I'm going to be sitting over here like, hey, what's going on? Right? So let us see. We're going to go to, so you went to special, right? Let's see. What other questions do you in what I used to check it out? Okay. So let's see. Thebootnurse.com/special. Here it is, right? Bootnurse.com/special. Okay. The page is live. Everything's working with it. So let's go back. Thebootnurse.com/special. Let's take a look-see and see what's going on. Okay. So it's thebootnurse.com/special. I'm going to show you right now. I'm going to unplug. I'm going to show you right now, because I have the website pulled up, right? So it says it right there. Thebootnurse.com/special. And then when you get to it, this is what it's going to look like right here. All right. So is it the tab, like, so you might have to put www, but it's working. It's in there for sure. It's in there for sure, because here, I'll even show you again. So here, once you decide that you want to go buy now, it'll take you here. And then see, it says you get a 7-day trial, right? And then every month it's $48, just like that. Just like that. And then right here, it'll tell you that, you know, about getting you get the course, you get the 7-day review, you get the next generation NCLEX review, you get to be a part of the community, you get 60+ videos, you know, weekly live streams with me, your mentor, and then we get content that gets added to it all the time, right? So it's there. It's there. I don't know what browser you're using. Maybe I don't know if you're using Chrome or anything like that. So it says, does the $48 go through after the 7-day immediately, or after you click to extend? What do you mean? What do you mean, Lovely? Like, elaborate for me. No. So what's going to happen is that you're going to pay the $7, and then after the seventh day, it's going to automatically charge whatever you have on file. If that answers your question. What's up, D? I see you just joined. All right. Okay, that's what I meant. Okay, cool. Yeah, for sure. So it's just like any other subscription that you would have, if it's like what, Netflix or Hulu or OnlyFans, whatever. What? But anyways, hopefully that was able to clarify for a bunch of people with regards to the NCLEX course. Like I said, you can check me out on YouTube. You can check me out on Instagram. You can check me, of course, here on TikTok. Make sure you guys are following in regards when we do NCLEX questions Monday, Wednesday, Friday, 5:30 Central Standard Time. But yeah, that's what we do. Are there any like save rounds? Any last questions, last big questions before I get off here? I'm already sitting at like 2 hours, like on the dot. All right, ladies and gentlemen. Well, if nobody has any other questions, I want to thank everybody who still hung out, and I want to thank everybody that participated in the NCLEX question type of review that we did earlier. Like I said, make sure you guys go check out everything I got going on. Check out when you go to my main page, check out the links, the link tree in the bio. They work because I do them all the time. I don't know why they don't work for y'all, but they work. Maybe it's because I'm live. I don't know why, but make sure you guys go over there and check that out. And be kind to yourself. All right. You only got one you. Everybody gets so stressed out about this exam, but I'm telling you right now, these hospitals, these jobs don't give a shit about you. All right. So you need to take care of yourself physically, mentally, spiritually, of course, financially. Right. These tests ain't going nowhere. You have a good night too, Geraldine. Curry Mom, you're welcome. But like I said, these tests ain't going nowhere. You know what I'm saying? So prepare adequately for them. All right. And with that, ladies and gentlemen, I appreciate all your questions. Lovely R, you are very welcome. And I will hopefully see everybody on Friday. I got a lot of stuff to do on Friday, but I will hopefully see everybody on Friday. But until then,